February is Heart Month, and in this segment we take a look at the newest procedures to help people with heart disease and talk prevention with medical experts. Carolee McGrath sat down with Dr. Aaron Kugelmass, Vice President and Medical Director of the Heart and Vascular Program at Baystate Medical Center, and Dr. Thomas Schwann, Associate Director of the Heart and Vascular Program at Baystate, to learn more.
The biggest issue in the United States is and has been for a long time what we call coronary artery disease and then the problems that follow it, which it really refers to as a buildup of cholesterol and other things in the walls of the arteries that feed the heart. And this is what typically causes heart attacks. Once a heart attack occurs, the heart muscle itself basically dies. And once that happens, things like congestive heart failure and bad heart rhythms can ensue. So if you can get to the bottom of the coronary artery disease problem, you can fend off a lot of different problems all at the same time.
Does congestive heart failure have to follow a heart attack, or can that be separate? And can you explain it?
Basically, you can break congestive heart failure down into two different types. The type where the heart muscle is weakened and it cannot pump, and then a different type called diastolic heart failure where the heart muscle fails to relax adequately. This then drives the pressures in the heart higher, which then impacts the lungs. It makes it very difficult for people to breathe. So you can have heart failure, two ends of the spectrum, one where the heart won't pump and one where the heart won't relax. And there are lots of different causes for both of those.
And when you're talking about coronary disease, you're talking about how can you reverse that? There are some pretty simple ways to avoid that or to reverse those signs?
The best way to avoid it is to avoid things that are have known impacts on the buildup of cholesterol inside the heart arteries, which would include high cholesterol levels itself, smoking, high blood pressure. I think inactivity is emerging as a risk factor as well as some others. Once that has occurred, the key is to stabilize that cholesterol buildup to make sure that that plaque or cholesterol buildup doesn't rupture and cause a blood clot to form. The new classes of drugs, first the statins, really have been shown to stabilize plaques as well as to reverse them in some cases. And there's a new set of drugs called PCSK9 inhibitors that are even more potent. Those need to be injected and are still restricted to people who have really serious cholesterol problems that we otherwise can't control.
Dr. Schwann, what are some of the latest advances in helping people who have had a heart attack and some of the new surgical procedures?
There are a number of approaches. Number one is that we can give them medications. Number two is if the coronary disease is mild to moderate, then we can subject these patients to a stent procedure where we essentially crush the blockage itself and reopen the blood vessel and recanalize the blood vessel. And then in those folks who have extensive and very advanced coronary disease, particularly in diabetics and particularly in those individuals who have had a heart attack, whose heart function is diminished, under those circumstances, the best long-term approach is to have a bypass operation. And the bypass operation is exactly as its name implies. We take blood vessels from other parts of the body and we transpose those blood vessels into the heart circulation, so the blood flow through the native diseased blood vessels will stay the same, and then we will supplement that with additional blood vessels. And those blood vessels can come from the legs, from inside the breastbone, or alternatively from the upper extremities. And traditionally, the operation that 90% of the patients in the United States get today is using one artery from underneath the breastbone and then supplemental veins from the legs. And what we have pioneered and what we have found is that increasing the number of arterial bypasses to fix the arteries in the heart as opposed to using venous channels increases the patient's life expectancy, decreases the need for reintervention, and improves the patient's outcomes.
Cardiovascular disease is the #1 leading cause of death for both men and women. I think that still surprises people, especially when you add women into the mix on that.
Well, I think what we can say is that the nature of the disease has changed over the decades. The types of patients who typically will present with a heart attack in 2020 are very different than the profile of the 40-year-old man in the 1960s. We have not abolished heart disease. We have reduced what it otherwise would have been, and in many ways we have delayed it to a much later stage of life. And women are thought of as being protected up through menopause, and as the timeline of atherosclerotic cardiovascular disease has sort of marched into the elderly population. At its onset, women now are joined by men.
How do you know when to call the doctor or even 911? Because I think some people might be reluctant, thinking, geez, I don't want to cause alarm. How do you know the right time to do that?
Well, women typically think, like, I shouldn't be causing alarm, and they're more worried about their husband, and they need to be worried about themselves, because if they're not around after a heart attack, there won't be anybody to worry about their husbands. We're at a time in medical science now where we have very effective treatments for heart attacks, and the quicker we can apply those, the quicker we restore blood flow to the heart, and there's less overall damage. If you think back to what we just talked about in terms of the heart muscle dying, we can prevent that if we can get that blood clot removed and pushed out of the way quick enough. At this point, we've made a lot of progress in how we deliver that care inside the hospital, and even how we connect between emergency medical services and the hospital. The biggest delay now, and the biggest challenge we face, is what you just said, getting people to contact medical contact. So if you have symptoms like squeezing chest discomfort, you can't breathe suddenly, you pass out, I think that's cause to call 911. If you're not feeling right, going up the hill on walking the dog is not what it used to be, it's time to go see your doctor.
I think something that also surprises people too, and I'm sure Dr. Schwann, you can talk about this, is that when you have somebody who's extremely athletic, maybe a middle-aged person, but unfortunately we hear those cases where, oh my gosh, they were in perfect shape, how could they suddenly have a heart attack? Even in those situations, you have to look back at family history. I mean, how can you help advise people on what to look for?
There's this whole spectrum of how patients present with heart disease. Some folks present indolently with progressive chest pain. Some folks present with a cardiac event such as a heart attack, and some folks, unfortunately, as the first manifestation of the underlying heart disease, is sudden cardiac arrest and sudden cardiac death. That's why it's important, and a lot of sort of public health focus has been spent on developing bystander CPR, because the faster we can resuscitate those patients at the site of the event, which typically occurs outside of the hospital, the better the likelihood of survival. As aggressive as we have been, the chances for an out of the hospital arrest, a patient surviving, is less than 5%. So we have still a long way to go. But I think that, what I wanted to emphasize again is that we have made a dramatic progress over the last 50 years. We've developed medications, we developed interventions, we had a very aggressive public health events to try to make people aware that a healthy lifestyle is really important. We also learned a lot from the Vietnam War, where a lot of young folks were subjected to casualties, and we found that this heart disease really begins very, very early, much more so than we had anticipated. So these fatty streaks that occur, which is the precursors of atherosclerotic plaque, can occur as early as in the late teens and early 20s. So this is a chronic problem that is a reflection of our lifestyle. And I think that it's absolutely essential that we do what we can possibly do to control the environmental factors, because the genetics we're not going to change in the foreseeable future. Maybe with some genetic manipulation down the road, we can potentially modify that genetic profile. But today, the environmental factors are going to be the factors that are going to be the most important in terms of trying to extend the life expectancy.